Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you are all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others around the internet. In the last episode of Know Your Mind segment, we spoke about the causes, diagnosis, and treatment of voice disorder. In this episode, we begin our analysis of resonance disorders and focus on their nature, characteristics, and causes. Let us speak about what resonance consists in before we can speak about resonance disorders. Resonance is the quality of voice that results from sound vibrations in the throat, mouth, and nose. It is a modification of sound from vocal folds that is determined firstly by the size and shape of the vocal tract, including the cavities of the throat, mouth, and nose. Secondly, by the position of the tongue. And thirdly, the degree of mouth opening and the lips rounding. During normal speech, the throat muscles move to close soft palate muscle on most sounds in the mouth. This closure keeps air from escaping through the nose. When air does escape through the nose, it can make the voice sound nasal. Thus, normal resonance is achieved through appropriate balance of oral and nasal sound energy based on the intended speech sound. Resonance varies for vowels, voiced oral consonants, and nasal consonants in different languages and dialects. For instance, in English language, most vowels and vocalic consonants are predominantly oral. That is, they are produced when there occurs the closure or near closure of the cavities of throat, mouth, and nose. However, resonance disorder should not be confused with nasal airflow errors and distortions. Nasal airflow errors are related to articulation when there is an inappropriate escape or release of air through the nasal cavity during production of pressure consonants such as P, B, T, D, K, G, F, V, S, and the like. Nasal airflow errors can be categorized into three types. First, learned errors. They are maladaptive articulation errors that are produced through the nose and used to replace oral fricatives such as nasal fricatives, throat fricatives, and nome-specific nasal emission. Second, obligatory errors. They exist due to structural abnormalities that result in throat, mouth, and nasal insufficiency and oral structural deviations such as oronasal fistulas, dental deviation, or malocclusions. And third, compensatory errors. They are actively learned maladaptive articulations that develop in response to abnormal structures found in voice-producing organs. These articulation errors should not be misinterpreted as resonance disorders. Similarly, resonance disorders are not strictly voice disorders, though they are often mislabeled as voice disorders. A voice disorder is concerned with the production and expression of voice, namely phonation and communication of voice, targeted by resonant voice therapy. However, resonance disorders have nothing to do with the production and expression of voice, but have to do with the overall quality of the voice. Resonance disorders occur when the quality of voice changes as it travels through the different shaped spaces of the throat, mouth, and nose due to improper closure of their cavities. Hence, resonance disorders result from too much or too little oral and nasal sound energy in voice due to structural and functional problems in the throat, mouth, and nose. Thus, children and adults with craniofacial disorders such as cleft palate and cleft lips commonly have resonance disorders, having problem with the quality of their voice. Resonance disorders can occur when the soft palate and throat do not function properly to prevent the transmission of sound into the nasal cavity. Some of the causes include: first, physical structure of the throat, mouth, and nose. For example, short, soft palate. Second, movement of the throat, mouth, and nose areas. For example, inadequate movement of the soft palate. Third, inadequate learning. When the child learns to make sounds, certain sounds are pronounced incorrectly. Fourth, blockage that prevents sound transmission into the nasal cavity. For example, for nasal speech sounds such as M, N, and NG. And fifth, some risk factors include structural deformities of the vocal organs such as cleft palate, cleft lips, enlarged adenoids or tonsils, and craniofacial disorders. In the next episode, we will elaborate on the types and symptoms of resonance disorders. Thank you for watching this video. Stay blessed until we see you again with another video.